Hello, and thank you by following our plans here at Dulwich Dental Office. As you can see, we're trying to make our lives in this new world as safe and as comfortable for all our patients. What we've decided to do is that every patient will be contacted, most likely the day before, to find out what their exact needs are so that our entire team is prepared for your arrival. This way we can ensure that as soon as you come through the door, come up the stairs using all the hand sanitizers, you'll be taken straight into the appropriate surgery, be it surgery 1, surgery 2 or surgery 3. We ask patients to arrive no more than say 10 minutes prior to their appointment, and we ask you to do whatever you can to not be late, because we want to try and keep this waiting area as empty as possible. As you can see, unlike before, we have one chair here, we'll have one chair just on this side over there, and one chair in the corner here. So the maximum that will occur is that if there are any patients in each surgery, there'll be 3 people sitting in the waiting room. As you can see, what we've done, we've managed to put all our screens around our reception, so our reception area can be happily continuing with their works. You're going to be having a lot of communication with the reception, probably prior to your appointment, so that we can ascertain exactly what your needs are. This way, it reduces the amount of surgery time, and it reduces the amount of time that the dentist needs to have with you to ascertain what your problems exactly are. This way around, the entire team will be ready for your visit. If it's a checkup, that's straightforward. Let's say, for example, you need a procedure, be it a crown, a filling, an implant, whitening, straightening, Invisalign. They know what your treatment is. The appropriate instruments are taken out and ready for your use, so that the treatment can start literally as you walk into the room. We're going to welcome you to come to the surgery. You'll be standing outside, and as you come to the surgery, we'll ask you to wait at the bottom of the stairs, where somebody will come and take your temperature with our temperature gun. Once we've taken your temperature, we're going to ask you to use the hand sanitizer to sanitize your hands. Exactly, wipe your feet. And we're going to ask you to make sure, again, as we have asked you over the telephone, to ensure that you've not been in contact with anybody who's had a sneeze, a cough, a temperature for the last 2 weeks, or if you've been in contact with anybody who's had any of those symptoms. After that, you'll be welcomed straight up into the surgery. As you walk into the surgery, we're going to ask you to come straight up the stairs. You've already used the hand sanitizer downstairs, and we're going to make sure that we have minimal number of people waiting in the waiting room, if any, and we're going to have the surgery ready for you that you're being seen in this case, surgery room number 2. So you'll be invited to come into the surgery, and as downstairs there's a hand sanitization center where you can sanitize your hands yet again, and we're going to invite you straight into the room, and we're going to ask you to take a seat straight into the dental chair, while your dental team, the dentist and the nurse will then be able to assist you. This way we're going to have minimal contact across with all patients, minimal contact at the waiting room, things such as medical history forms, consent sheets, all of these things will be discussed with our patients. We may ask you to send us photographs, images, possibly even videos to the nature of your problem, and this may be discussed with you by the dentist prior to your visit, again, for everyone's safety and to try and minimize the number of contact minutes that would occur without actually carrying out treatment. As much as we like the introduction and the discussions with the patient, if all of these can be done, or as much as possible can be done remotely, it'll allow us to use the room for clinical purposes. Once the dental treatment is finished, again, we're going to be asking you to use the antiviral mouthwash. You'll then be asked to hand sanitize as you leave the room, and again, we're going to try and make sure that each appointment is done with as little interruption or as little time needing to be spent at the reception area. In other words, treatment plans and consent forms shall be dealt with prior to the appointment. We ask you to please bear with us, that in the sense that if there's anything that we need to do to try and help, please understand that downtime between patients may be a little bit longer. We're going to need a little bit more time to ventilate the room, clean the room. Not that it needs to be anything longer, but at the moment, the best practice is indicating probably patients once every 40 to 60 minutes, so please bear with us. And as a result, we are determined to still see all our patients when we reopen, and to be able to use a full long day, potentially starting from 8 o'clock in the morning till 8 o'clock at night time. Also allowing all our patients that would love to see the hygienist, potentially having hygienist weekends, be it Saturdays, Sundays. So please watch this space as we're trying to do whatever we can to keep our patients happy in this new world of dentistry. It's the same team, we're just behind further protective clothing, looking to welcome you. It's still the same. It's myself, Dr. Sia, and Gabby, and with Dr. Pooja, Dr. Rebecca, Dr. Yushmi. We're the same members of staff that have always been taking care of your dental needs. When you come into the surgery, you'll find that there's hand sanitizers, both inside the room and also outside the room. We will also encourage our patients when they come in to have a thorough rinse with an antiviral mouthwash. That way we are trying to minimize all forms of risks and ensure that we can still provide you with the best and optimum treatment.